Yossi Media and the American Heart Association presents Check In and Check Up for Your Health. September is Peripheral Artery Disease Awareness Month. You may be unfamiliar with peripheral artery disease, or PAD, but it affects more than 8.5 million people in the U.S., and Black Americans are 2 times more likely to be impacted by it. So, it's time to talk about it. PAD is a disease of the blood vessels outside the heart that causes reduced blood flow to the body. Many are getting unnecessary amputations of their toes, feet, or legs as a result of undetected PAD. The American Heart Association is joining Sybil's team to help people understand the risks and symptoms of PAD. PAD most commonly affects the legs and feet, and pain in the feet, legs, thighs, or butt may be a sign of undetected PAD. The most common symptoms are burning, aching, numbness, fatigue, or discomfort in the leg or hip muscles while walking. This discomfort is caused by the legs not getting the blood they need. If you smoke or have diabetes, you have a greater risk for developing PAD. Age, high blood pressure, and family history also put you at risk. Being diagnosed is the first important step to avoid serious problems like amputation. Today, joining Sybil in this important discussion is comedian J. Anthony Brown, Dr. Lee Kirksey from the American Heart Association, and Lynn Amos, a patient who lives with PAD. If you have any kind of recurring leg pain, talk with a doctor and describe when it happens and how it feels. Learn more at heart.org/PAD. And now, here's Sybil.
Thank you so much, Tony Scott. We appreciate that. Hello, everyone, and welcome to Check In and Check Up for Your Health. I am Sybil Wilkes, and we are here regarding our partnership with the American Heart Association. As we've been discussing in our What You Need to Know newsletter over the past few weeks, this is National Peripheral Artery Disease Month, or PAD. Peripheral artery disease affects as many as 10 million Americans, yet it is widely misunderstood by most of us and often goes undiagnosed. This young fellow who is joining me here
I'm
is
like, who is she talking about?
my former partner in crime from the Tom Jordan Morning Show, J. Anthony Brown. Welcome in. How are you?
What up, Sybil? How you doing?
I'm
Good.
doing well, thank you.
I'm really glad you're talking about this since it affects so many African American men and women and
Yes.
sometimes children, right?
I'm not sure about the children, and we can find that
Hmm.
out from Dr. Kirksey. But it is a treatable disease, and
Hmm.
with early detection, it's believed that millions could avoid serious health concerns related to PAD. J. Anthony Brown, I asked, but I'm going to ask you again. How are you? How are you really?
Well, today I'm fine. Right now, check with me in about another hour and we'll see what's
Okay.
going on. But right now,
Okay.
everything's good.
You know him, you love him as a star of comedy stage, small screen and large, and a writer of hit TV shows,
Very
including Judge
small,
Steve,
very
bitty
small
screens.
screen.
Steve Harvey, he was a writer for Judge Steve Harvey's show. And of course, as we said, for many years, a co host of the Tom Jordan Morning Show. Jay, you really are I was going to call you the poster child, but you're the poster man for many health challenges facing
For
Black people
everything, huh?
and having, but here's the thing, you are very proactive about your health. Um, do you have, did your health challenges start with your bout with diabetes?
Probably, yeah. More so, it started with diabetes, which is something I didn't even know I had. And I'll be glad when a doctor comes on so we can talk about this blood disorder and the numbness, because this can also be misunderstood for neuropathy. You know,
Hmm.
neuropathy is causes a numbness in the feet or
Look
sometimes in
at
the hands. So
you.
I want to make sure, how do you tell the difference between hello, hello, that's why I'm here. I'm here for that reason. And it can sometimes be confused for that problem, which I have because of diabetes. So when a doctor comes on, they can clear that up.
Well, let us do that. We come together today to provide information, hope, and advocate for awareness. So let's welcome in Dr. Lee Kirksey. He is a board certified vascular surgeon. He obtained his undergraduate degree and medical degree at Ohio, I'm sorry, the Ohio State.
Look at you.
I say that as a Northwestern grad. So
That's right.
much respect. Dr. Kirksey is a board certified vascular surgeon and is professor of surgery at the Cleveland Clinic. Lerner College of Medicine, and a Chief Equity and Community Engagement Officer within the Heart and Vascular Institute. The Cleveland Clinic is entering its 27th year as the U.S. World and News top rated heart and vascular center in the nation. I would say the world. The Cleveland Clinic is known throughout the world, Dr. Kirksey, for the good work you all do there.
I appreciate it. No, I think we have a pretty good reputation, I like to say.
Absolutely. Your additional research, as I've been told, includes investigation of the origins and identification of solutions to mitigate health and healthcare disparities in low income and minority groups. So, with all of, and I didn't even get to half of all of your accolades and things in your resume. Doctor, welcome in. Thank you so much for joining us, Dr. Lee Kirksey.
Thanks for having me. I've listened to you guys many mornings driving into work on the morning show, so I
And,
feel
and,
like we're
and
old friends.
And still, you came on with us today.
That's
We
right.
appreciate
Yeah, yeah.
it.
I just hope Jay Anthony doesn't go in on me, so I know he has
No,
a
No,
no, no.
field.
Oh, no, no, no. You don't have that to worry about. If anybody goes in, it'll be simple going in on me. So don't worry about it. You're fine. You're in good shape. You're in good shape.
Doctor, as you know, we are discussing peripheral artery disease or PAD, and we've been doing this in our newsletter for the month of September. Can you break it down for us? Peripheral artery disease is what?
Yeah, yeah. So let me first say that PAD or peripheral artery disease has a PR problem, right? You talk to
Mm,
the uncle and you say somebody had a heart attack or a stroke, or to use Jay Anthony, I heard him say the sugar, right?
mm.
Everybody knows what you're talking about, but when you talk about PAD,
Yeah, yeah. Don't we
people
said
don't
the
really
sugar,
know,
right, right.
right? And so, peripheral artery disease is essentially cholesterol and fatty buildup within arteries, right? And those are really arteries outside of the heart. But it's the same process that it can affect the heart arteries, the arteries of our brain that can cause you to have a stroke or a heart attack. It's just occurring outside the heart. And the most common area that it's located is in the lower extremities, right? And that increases people's risk of having disability, disabling walking symptoms, or in the most severe state, I'm sure what we're going to talk about, amputation, where they get ulcerations or infection, and that can lead to amputation. So PAD is the most important part of it is that it's diagnosable. We can identify it early, and we can reduce the risk of someone getting to that point of needing an amputation. So it's a process that if we identify it early, we have good treatments.
So as we have said, an estimated 8 to 10 million Americans affected by PAD, and many of us never heard about it until this month, as we have PAD Awareness Month. And nearly 1 in 3 Black adults, yay, we're number one again, and may develop PAD. If so many, and you said there is a PR problem, but why don't we know about this disease? What's the holdup in spreading the word, and not the good word, but spreading the information about this disease?
Yeah, well, there are many, as you said, there are many things that we lead, unfortunately, from our Black American community, whether it's,
Yeah.
breast cancer or colon cancer or heart attacks and strokes. And so
hmm
it kind of falls behind some of those other disorders, but it's no less disabling and devastating in its most severe manifestation. And so that's what we look for folks like you guys to be able to extend that message in a way that people are informed.
So you talk about the narrowing of the arteries. Is that you? Is that what we used to call, or my grandparents used to call, about hardening of the arteries?
That's right. That's right. And what you think about, I think about it a couple ways. So the food that we
hmm
eat, the cholesterol, the fat in the food
Yeah.
that we eat can cause narrowing of the artery. Salt, sugar, fat, all those things. Smoking, particularly, can cause inflammation of the arteries or hardening of the arteries, to use your grandparents' terminology. And both of those things narrow the arteries and can cause these symptoms.
Now, one of the terms that I've been using is about the lack of activity in the veins, but we're talking about arteries as opposed to veins.
That's a very good point. There's two parts of the circulation: the arteries that take blood away from the heart to the rest of our body, including the lower
hmm
extremities, and the veins that return blood. So you're right. We're talking about the arteries. hardening of the arteries or narrowing of the artery caused by this cholesterol buildup, this fatty buildup.
So
Go ahead, Sybil. Go ahead.
no,
Go
go,
ahead.
go, Jay.
I
Go ahead.
was talking earlier, and I don't know if you heard me speak about it in terms of neuropathy, in terms of this disease. How close are they, and is there any similarity to the two? Because I guess both can be brought on by diabetes. I'm not sure.
Yeah, Jay, you were spot on when you said that they can occur separately. You can have neuropathy from diabetes and PAD, and they can be separate or they can be overlapping. And so
Mm-hmm.
that's why it's so important. If someone they believe that they have neuropathy, then their physician, their caregiver should be doing some type of testing to make sure that that neuropathy is not PAD, right? And so we can distinguish the two, but sometimes they can occur together. And so that's why it's so important for the listeners, the patients, and families to be educated to say, hey, I have neuropathy. Are you sure I don't have PAD? Can we do some basic testing? Because the testing is essentially a blood pressure cuff around your ankle.
That's
Many times
interesting.
we're concerned about testing because we think it might be painful or it might cause some harm, but this is simply just like you get a blood pressure cuff in your doctor's office around your elbow, it's around your ankle. And then we can identify the presence of PAD.
I
So,
thought that was fascinating,
yeah.
the
Mm-hmm.
ankle cuff as
Yeah.
opposed to the arm. I'm sorry, Jay, go ahead.
So when you have, I do have neuropathy. So what test should I ask my doctor for? Because I do have the tingling sensation in a couple of toes. And what test do you ask the doctor to look for to make sure it's not the other disease we're talking about?
Absolutely. So, Jay, you tell them number one, I'm concerned that I have PAD because I have this pain, this
Mm-hmm.
neuropathy. They would do a good physical exam because
Right.
sometimes we jump to testing before we even touch our patients, right? So, we got to do a good physical examination. And then they do what's called an ankle brachial index. That's what Sybil was referring to. That idea of taking the blood pressure cuff, putting it on your ankle, and then essentially we compare the blood pressure in your ankle to the blood pressure in your arm. That number should be greater than 1. So your blood pressure in your ankle should be higher than the blood pressure in your arm. That's a normal finding. So
Mm.
that's a very
Doctor,
simple. That takes 10 minutes, literally 5 or 10 minutes.
wow.
Right.
And can our normal physician do this, our GP, or do we go to a vascular specialist such as yourself?
Your normal physician, primary care, advanced practice, nurse practitioner, they can do that test in the office. They can order that test. You don't need to go to a specialist to get that test there. And that's
Mm-hmm.
the unfortunate part of this, right? If you can get to a healthcare provider that can do this test, we just need to be able to engage them and they need to listen to us,
Right.
right? They need to
Yeah.
not be
Mm. Yeah.
dismissive when somebody
Mm-hmm.
says, like Jay, that I have diabetes. Oh, you just have neuropathy. No, you might
Mm-hmm.
have PAD. So let's get this. And what happens if it's normal and you don't have PAD? Nothing lost, no one harmed.
We do have a question from one of our viewers. Yolanda, if you could put that up, please. So Renita Bland from Facebook says, "What are the numbers for the ankle? Because we know we're looking at normally from our arm blood pressure. What about the ankle?"
So for a normal value, the blood pressure at the ankle should be the same, if not a little bit higher than the blood pressure in the arm. That's just some physiology and anatomy that's not important to get into, but that number should be the same or a little bit greater than the blood pressure in the arm.
Let me ask you about this because normally we talked about what's are some of the signs, and you talked, and in the opening we talked about the pain in the lower extremities and the hips and the buttocks and the legs. Are there other signs, and could it be that we're looking at something we just need to differentiate between normal pain and
Mm-hmm.
aging?
That's
Could be
right.
Mm-hmm.
arthritic of some kind, and so by testing we're able to make that difference and differentiate between what we're talking about.
Man, I don't even have to be on here. You guys are too good with this stuff.
Oh no, we need you,
No, no,
doctor.
we need you. No, 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 you're definitely needed for this. Yeah.
Yeah. So essentially, the symptoms are usually with exertion, right? So I walk for a block or 100 feet in a severe instance, and I may get pain or cramping or burning.
Mm-hmm.
People use different terms, and that's part of it, right? Pain, my leg catches in the calf or in the buttock or in the thigh. That's one of the early signs of PAD. That's called claudication, but that's one of the early signs of PAD. But that, as you said, that might just be us getting old, right? A little
Hmm.
musculoskeletal hip problems or some knee
Mm-hmm.
problems. So again, ask your doctor, simple test. In the more severe stages, patients may get discoloration of their toes or
Mm-hmm.
pain within their foot without even doing anything. It's called rest pain, and usually it occurs at night, but it can occur at any time. And then
Mm.
in that most severe manifestation, patients get erosions or ulcers on their feet, maybe after they get
Wow.
discoloration, or to the what you were describing early, Jay Anthony, someone who's diabetic, they may get a sore on their foot because they don't have good sensation. But if they have PAD in the background, that
Mm-hmm.
sore is less likely to heal up, right? That's why
Wow.
that combination of having diabetes and PAD can be devastating.
No,
We're gonna take.
let's
We're gonna.
go
No,
ahead. Well, oh,
I
yeah,
just
wait,
want to
take a
say
break.
no.
Okay.
No, I'm gonna ask you to ask your question, and then we're gonna take questions. We're gonna take one more question, and then we're gonna go to our next guest, who is Ms. Lynn Amos, and she is one who is living with PAD. So Jay, you go with your question, and then
So
we'll.
my question is it a medication that you're treated for, or is it exercise, or what is the
Or there's supplements we can
yeah,
take. There's
Yeah,
supplements? Yeah, what was it that you to solve the problem or to alleviate the
that's
problems?
a
Yeah,
good question, Jay, because
deal with
really
it.
what we're talking about, get diagnosed early, and then we can institute these things. So first, we
Mm-hmm.
help you modify your diet: low sugar, low salt, low fat, a lot of veggies. All the things that
all the things you
sometimes
love.
we do or we don't do. And I've heard about your diet, Jay. So we'll talk to you.
You know,
If somebody's
actually, thanks that you brought that up. It's weird that I got older to start eating better. You know, it really
we get
is, and
enlightened.
yeah, we do. So yeah,
And he
I'm
got
here for
ill
that.
too.
Yeah, I got ill. Like, let me stop all the BS. Okay.
If somebody's a smoker, we'd work with them, and that goes to all the people who smoke. We know it's not easy to stop smoking, so we have many tools, and we don't just say stop smoking. You can do it. It's sheer force of will. We know it's
Hmm.
difficult, so we give you resources to do that, and then stay active. Right? That's
Hmm.
that's the most important part because that
Right.
can reduce your weight. When you stay active, you're more likely to lose some of those pounds.
Right.
You're more likely to get out there, and walking in and of itself is a treatment for PAD. It's a treatment
Oh,
for
it is.
PAD. It
How
is.
how far do you have to walk?
Yeah. Yeah. So for these people that have this discomfort when they walk, called
Uh-huh.
claudication, we encourage those people to walk as far as you can. Where you get discomfort, try to walk through
Uh-huh.
it, then you rest, and then you walk some more. It's no different than being at the gym and trying to build your muscles. You're trying to build your ability to your muscles to process the oxygen that they're receiving.
Okay.
Dr. Kirsty, we have a question from one of our viewers and listeners. Dora Levette Tiggs on Facebook says, "Is restless leg associated with PAD? Restless leg syndrome, I think they call it, right?"
Yes, yes, that's a good question from the viewer and listener. So restless leg may be associated. Restless leg can be some type of neuropathy that Jay
Mm-hmm.
Anthony's talking about. Sometimes people think they have restless leg and they have PAD. So
Mm.
the best part of that is if you have restless leg and you came into my office, I would get an ankle brachial index on you. By the time you left my office, I'd be able to tell you that no, this is not restless leg, this is a manifestation of PAD, or
Mm.
I'd be able to tell you you have normal circulation and
And
talk to your
Dora
primary care doctor.
and Dora continues on Facebook. Sometimes it's both neuropathy and PAD. It can be one or the other, or it can be
Or
both.
it can be
It,
both. Oh, okay.
one or the other, or both.
Wow.
Wow.
Okay. Let's go to our guest, Lynn Amos. Ms. Amos is a woman who is living with peripheral artery disease and coming to us from Mississippi. Hello. Can I just give you your flowers right now? Lynn Amos is coming to us from Mississippi. She now serves on the American Heart Association Patient Advisory Board. and is seeking to educate people about the importance of being screened for PAD. You've lived with diabetes for nearly 50 years, and you've
Wow.
long known to watch your insulin levels, eat healthy, and exercise regularly. Welcome in, Miss Amos. And can you start off by telling us how did you learn about the connection between peripheral artery disease and diabetes?
Well, actually, thank you for the welcome. It's good to see you.
It's
Uh,
great to see you. Thank you for joining us.
a friend of mine, there was going to be a health fair where I live, and she said, "You know, you're diabetic," and she also works in the health field. She said, "You probably ought to go to this," and I said, "I don't know, you know." And she kept bugging me about it, so I said, "All right, I'll go." And was floored. I had never heard of PAD, had no
Wow.
idea what it was. Fortunately, this health fair also included screening, and so that's basically they at the screening they either let you know, well, you know, you're doing okay, you're doing fine, or you really need to come into our office for further testing. So I was one
Wow.
of those folks who needed to come into the office for further testing.
This didn't happen to be a take a loved one to the doctor event, was it?
No, 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 no,
Yeah.
But
no.
a health fair and doctor
But
coming into an office, I guess, such as yours, and going through the additional screening process.
So
That's what it
before you
sounds
went
like, Miss
to
Amos.
the before you went to the quote unquote health fair, did you have any type of symptoms before you went there, or there was nothing wrong, or what was it?
no, I had symptoms, but I didn't know I was
Hmm.
having symptoms. You
Oh,
see
okay,
what I'm
got you.
saying?
Hmm.
Um,
Yeah.
you know, I had the I'll say a catch in my leg. I had
Hmm.
the sometimes a numbness in my feet, you know.
Wow.
But I just thought, oh well, I'm diabetic. Like a lot of
Hmm.
people, neuropathy. You know, I said I
Right.
know people tell me I'm going to get neuropathy. And by the way, Dr. Kirksey, what what is the difference in the testing for neuropathy and for PAD?
So neuropathy, they usually do a sensory test. They'll use some fine filaments to test what your sensation is like on your
Hmm.
feet, and if
Oh,
your
okay,
diabetes has
okay,
disturbed the sensation.
Do they put?
But
Is it a pinpricks kind of thing?
Or a
exactly,
feather,
yeah,
or like a
exactly.
yeah,
pin. Right, right. Yeah.
Yeah, but a diabetic should have both tests. That's a good point that you make there, Miss Amos. That a diabetic should have not only a test for neuropathy, but an ankle brachial index to test for PAD. So both of those tests.
right, right,
So
absolutely.
go ahead, Sybil.
No, I was just going to point
So
to you,
with the
Jacob.
test, if you have feeling in your quote unquote feet or hand, or where where they stick you and you feel it, but you still have the sensation, that means you could have the feeling and still have the neuropathy, or the other one I can't remember, at the same time, meaning it hasn't taken over your body where you don't feel anything. Is
That's
that
right.
is that okay?
That's right, and that's why diabetics are more prone just from some minor trauma of a shoe, or
Mm-hmm.
sometimes something happens to their foot and they believe that they have normal sensation because they do have sensation, but it's not normal, right? So that's
Right.
important for their primary care, their podiatrist, their care team to understand what degree of neuropathy may exist.
Ms. Amos, you look like a woman who takes care of yourself, and it may have been in that taking care of yourself that you had a problem with a was it during a, uh, a, a having a pedicure? And
Pedicure, yeah,
was it?
yeah. Um, just the girl cut the toenail too short and it started to bleed. And so she stopped the bleeding. We went on with the pedicure and I didn't think anything of it. And it
Whoa.
really
Mhm.
didn't show, you know, because at this time I didn't know all the other stuff. But so then a few weeks later, I started to get the toe just kind of hurt
Hmm.
and
Wow.
it went from bad to worse. And the sad
Hmm.
part of it is, I went to the podiatrist. I went to a couple of other folks, and nobody seemed to understand what was happening with my foot. And Dr. Kersey, is that you know?
Is
That's
that
that's
Hmm.
normal?
Yeah,
So it's not normal. It's unfortunate, but that's why we're all on this
Right.
show this
Yeah.
evening, to
yeah,
Yeah.
increase
Yeah,
the
yeah,
awareness, and that is the PR problem that we're talking about. But that's also why, if we can educate patients and families to push when they don't get the answer that they know they should be getting, then
Mhm.
they feel empowered, right? Because that's what we
yeah,
need to
right.
do within our community. We need for folks to feel empowered to ask the hard questions.
right. I think
Right.
sometimes as people, not just black people, white people too, or just people in general, have a tendency to say, "Well, that's not a big problem, so I'm not going to check that out." You
It's
know, a
just your
tingle,
baby toe.
yeah, it's just my baby toe, so I'm not going to go check that out. If I have a chest pain, well, I'm going to go to the doctor right away. But a tingling is
Right.
something sometimes people just take for granted and go, "Well, I can live with that. It's not a big deal." And that's something like you're saying, whatever's like different from where your body is normally feeling, you should go and get it checked out right away.
Uh,
Absolutely.
But thank goodness,
You
Ms.
said the
Amos,
word.
you were persistent.
Yes.
You were
Yes.
persistent in doing this, and you knew, and maybe it was just an intrinsic thing. You knew that something was more than, oh, you just
Hmm.
have, an extended problem. As you get older, it takes longer for things to heal and things like that.
Right.
Right. Exactly. And so when things really started to get bad, I wound up at the wound clinic,
Wow.
and you know, worst case, there was, after, unfortunately, that came on at a time when it was just a little bit too late. The
Ah,
circulation still wasn't good. And so, since the circulation wasn't good, I wasn't healing the way I could have, you know. And I wound up with what the dreaded amputation.
mm-hmm.
Wow. Oh
Uh,
my God.
you know, but
So here you are now. What advice, Ms. Amos, can you? That's the best piece of advice you can give to people as far as you're living with peripheral artery disease and perhaps initiating a treatment for it.
living with it, it's a daily effort.
Mm.
Watch your diet. You don't have to
Hmm.
not eat everything that you don't like, but be real. If you're diabetic, you really need to be real, J. Anthony Brown.
Right,
Okay.
right.
I'm like,
Um,
whoa,
but serious.
whoa, whoa.
I think we're about to lose contact with somebody who's feeling a little
I know,
funky.
yeah.
Get some exercise. I'm not a person who loves to exercise, but I get out there and I try to walk 30 minutes several times a week.
Oh, okay.
And anything you can do. I mean, if walking up and down the road doesn't impress you, then walk around Walmart.
The
Whatever
mall.
you
Yeah.
can
Yeah,
do. The
yeah.
mall. Walk around
That's
the mall.
that's that.
Um,
Go ahead.
oh no. Oh, okay. Um, and then go to your doctor's appointments. Don't put them
Hmm.
off. If you
Mm,
see something, if I see something now, I check my feet every day, and that's very important. And
mm,
if I think something's wrong, I'm either at the foot doctor or the or the vascular
Hmm.
doctor.
Right.
Because I have had a couple of surgeries, vascular surgeries. Unfortunately, my diabetes is the kind that I wear a pump. And so sometimes
mm.
me and the pump have issues, and that means that my blood sugar goes up.
Right.
So, I'm not, but I am controlling it as much and as well as I can. And, I've gotten some really good reports over, over the last years. And so that's what you do. Don't stop, you know, um, excuse me, hold on.
I know sometimes you
uh,
got to block out the noises. I
yeah, yeah,
understand. I
yeah,
Yeah.
yeah.
understand.
Uh, you
And
know,
that was a good bit of exercise right there, if I do say so
Yeah,
myself.
yeah,
oh
yeah.
yeah, yeah. And just try, if you see something that looks like there's something going on, don't wait. Don't say, oh, it'll get better, or oh, I'll see about it, 3 weeks from now, or something like that. Because the sooner you have it checked out. If it proves to be nothing, then that's great. But if but excuse me,
I'm so glad
yeah.
I'm so glad that's not me. Oh, I'm really glad.
I am so sorry. I
No, no,
apologize.
no
That's
worries.
okay. That's all
That's
right.
that's
That's
the
all right.
beauty of real live
Yeah,
programming here.
yeah,
Dr.
yeah.
Kirksey, let me ask you because we're talking about treating PAD. Can it be cured?
PAD cannot be cured, right? The best case scenario is what Mrs. Amos is talking about here, getting to your provider early, having them
Hmm.
listen to you, instituting those dietary changes, having your cholesterol at a good target range, your blood pressure at a good target range, your diabetes well controlled. And guess what? You get a triple effect, right? That reduces your risk of having a heart attack or a
Hmm.
stroke, right? Because we
Right,
know the death rate when folks have a heart attack for the Black community is 30% higher than it is for other communities.
right.
The death rate for stroke is 40% higher. So you get a triple bang for your buck if we identify this PAD early, because we know more than likely you have these other processes going on.
Yeah,
Why
yeah.
why does
And
exercise
another thing,
go ahead, go ahead, go ahead, go ahead, go ahead.
now I was going to say another thing. Uh, get some sleep. Turn the TV
Right.
off.
Oh,
Yeah.
yeah.
You know, because if you feel fatigued, then you're not going to want to do some of the other things like getting
Right,
the exercise and all of that.
right. J. Anthony, what were you going to ask
Yeah.
Jay?
I was gonna ask a question. Why, they're always telling you to exercise. Why does exercise help?
Yeah.
What makes it help you out in
Yeah, exercise makes your blood pressure come down and easier to control. So, I talk to patients all the time and I say, do you have high blood pressure? And they say no, because they're on medication and their blood pressure is controlled, right? But yes, you have high blood pressure, right? It helps your cholesterol. It
Yeah.
does all of those targeted things that we're trying to achieve in terms of your blood work. It achieves those via non-medicinal ways, right? And that's what we're
Hmm.
Right.
trying to do. We'd all like to be on less medication or no medication at all. And if we can stay healthy on the minimal amount of medication, then we're doing ourselves a service.
Before we go
Okay.
to another question, I just want to remind people that we are having a discussion about peripheral artery disease in association with our partners, the American Heart Association, talking about a disease that has, as our guest, Dr. Lee Kirksey says, has a PR problem. We don't really understand what
Yes.
all of this entails, what it is, and what it entails, and that's what we're endeavoring to do today. Our guest is Dr. Lee Kirksey, as I said, and also Ms. Lynn Amos, who is with us today. She is a survivor of peripheral artery disease. She is living with it, as well as some other health challenges such as diabetes. And my co-host in absentia is J. Anthony Brown. And so, Yolanda, as we endeavor to get Jay back, let's go to the questions. Theramdin, I think that is on YouTube. What is the true diabetes threshold? I'm a 5.9 A1C, and doctor says that's not good.
Yeah, so the hemoglobin A1C is a little bit of a controversial area. In
Hmm.
general, the hemoglobin A1C should be less than 7 in that 6 range. I think 5.9 honestly isn't too bad, because what we worry about if patients with diabetes, especially as Mrs. Amos is talking about, insulin dependent, if their glucose blood sugar is too tightly controlled, it may bottom out. It may drop very low, and that's just as bad as the blood glucose being too high. And so 6 is not a bad, it's not a bad number if it's tightly controlled and consistently controlled.
Got it. Got it. J. Anthony Brown is back. Renita Bland on Facebook is cramping in the legs associated with PAD. My mother has diabetes and complains about cramps and swelling.
Absolutely. Cramping of the calves, cramping of the
Wow.
thighs. And I use cramping, but as Ms. Amos said, people use different terms:
Hmm.
catching, burning, aching. It's usually with exertion, but that is one of the early signs of PAD. And so she certainly should have her mother evaluated for that.
And how important is it? And I know women have, not just women but men too, have been guilty of buying shoes that don't fit because they're on sale.
Or because they
How
look
important?
great on your feet.
Yeah,
Yeah.
I'm looking right at you, Sybil. How important is that for us to? I mean, I totally changed the shoes that I was buying. I haven't wore hard shoes in years, so and it made a big difference in terms of my feet, how I feel on my feet. But it's something that do you recommend or do you tell people, hey, you shouldn't be wearing XYZ shoes, you should be wearing these shoes? Or is
Absolutely.
that
That's why it's so important to usually for a diabetic or a patient with PAD to have as part of their care team, because we talk a lot about having
hmm
a team of folks that are caring for
Mhm.
you when you have PAD or diabetes, that you have appropriately fitting shoes. And that's usually a shoe that doesn't have a narrow toe, because it's usually the minor trauma that can start an ulcer in a patient that
Right.
has PAD or has diabetes, and that minor trauma can come from a poorly fitting shoe. So
I
all the
was
shoe
trying to I
shoes
was
out
trying to
there.
show you the shoe that I've switched to. It's probably like the widest toe you ever want to see. It
Yeah,
almost looks like I have duck feet, but it's great. It is the best shoe ever that I've
Yeah,
ever
can
worn.
I add something to that too?
Absolutely.
Ladies, I love a pretty shoe, okay, and have worn the pointed toe, but no more. And I have found some really cool shoes. You can get, and look just as cute,
uh-huh.
but it is worth it because your feet are important. They carry you around,
Right.
okay,
It was. It was.
and
It was
so
so funny to see women who went to the Beyonce concert that when they went in their heels, but when they left, they were all walking barefoot because
And
because
carrying
their
our
feet were,
shoes.
yeah, they were
Yeah.
carrying their shoes. Yeah,
right,
so it's
right,
yeah.
right.
Can I just say hi? My name is Sybil. I wear a size 10, but if it's a good looking pointed toe, I will squeeze into a 9.5. I'm guilty of it. I will work on that, doctor. I will absolutely
Oh,
work on that.
But
Um,
can I make one more point
of
though,
course.
that Miss Amos, just to underscore what she said earlier? Pedicures, cutting your own toenails,
Yeah.
especially when you're diabetic and your vision may be a little bit impaired as a consequence of diabetes. Very important. That in and of itself sometimes is a reason to have a family member or a podiatrist or someone to help you with nail care,
they can
because
see, right?
that can see, right? So
Yeah. Yeah,
important.
absolutely. My mom used to go to a podiatrist and get her pedicures, as it were, from her podiatrist as opposed to going to a salon. And now
Right.
I just ask, and this is just for me, Miss Amos, I don't know about you, but I don't ask for them to cut. I just ask for them to file them down,
Right.
file my
And
nails down if
also,
possible.
yeah, I was
Yeah.
blessed in the small town that I live in.
Hmm.
Uh, a person opened a business. She is certified in diabetic care,
Oh,
and
awesome.
That's a
I
big
have
deal.
this is the person I've been praying for the last,
Oh, that's
because
nice.
Sybil, I actually stopped getting pedicures
Yeah,
because
Yeah.
of the disaster that I had.
of
But
course.
this woman works by herself, and you want to make sure that if somebody's doing something to your feet other than a podiatrist, tell them, like you say, speak up. You know, just file my nails and don't take no for an answer. And if they
Right.
don't want to do what you want, then leave them alone.
Right. Yeah.
Okay?
If they don't, yeah, absolutely, because it's your life, not theirs.
Right,
Um,
right.
yeah, yeah. As we are coming to a close of this, let's remind everyone that we do have some facts about peripheral artery disease, or PAD. Um, Doctor, as we've talked about, the hardening of arteries or the veins, or both could be a cause of peripheral artery disease.
That's right. That's right. And I'll throw out here for the partner American Heart Association, whom I'm a volunteer for, heart.org/PAD,
Hmm.
heart.org/PAD, because of course we won't be able to get all the facts in this evening, but people can
hmm
follow up and they can go to that website and get information. But yes, it's the hardening of the arteries, reducing circulation. There are 150,000 amputations performed,
Wow. Wow.
150,000 amputations. Half of those
And
folks
some of
have,
them are unnecessary because we didn't take care of ourselves, right?
some
Yeah.
of them are unnecessary. And Sybil, when we led with the idea that Black Americans are 2 times likely to have PAD, we
Hmm.
didn't mention the fact, and this is a horrible, horrible statistic, but just like everything else from breast cancer and heart attack and stroke, that even after we go to seek treatment, we're more likely to undergo an amputation or have an amputation
Wow.
recommended to us without having an attempt at restoring the circulation. And that is something that we have to reverse, that idea, empowering patients to speak up and to seek a second opinion, right? If someone tells you something or your family member, they recommend something, you always have the right to say, if this is not emergency and life threatening to me, I'd like to get a second opinion.
Right.
I got
I
to tell
just
you,
go
I
ahead,
don't.
Sybil. Go
Thank you
ahead.
for that, doctor, because
That's
I
Yeah.
was going to
really
say that
important. I want to
too.
thank you for that as well, doctor, because I don't take a yoga class, a structured yoga class every day, but I do my stretching and things. And one of the things that I learned is the importance of stretching, as well as, making sure your toes and your feet
Yes.
and your ankles, and doing your ankle turns and your hip movements and everything like that, really can help to keep the circulation and going, correct?
That's right. That's right. Active,
Yeah.
being active. And that activity looks a lot different for different people, right?
Hmm.
There's even there's even strong evidence, some people can't walk, but they can get on a stationary bike. Some
Wow.
people's hips or knees bother them. They can do arm exercises.
Water aerobics is good.
Evidence,
Yeah.
yeah,
Hmm.
water
Okay.
aerobics. So there's a lot of different ways that we can become active.
Yeah,
I
absolutely.
want to do a shameless plug before we leave, Sybil, because
Well, I do want to
I,
ask a question. So go ahead with your
I
shameless
want to
plug.
show the shoe that I was talking about. Can you see the name of that? Can you see the
Jomra?
name?
Jumra?
Yes, it is the widest toe you ever want to get in your entire life, and it's very comfortable. I'm not getting paid for this company,
Very
but
good.
they come in several colors, and that's what you need. And stop wearing those tight shoes, Sybil.
Yes,
That's
sir.
right, Sybil.
Thank you, Miss Amos. I thought we had something here, but I think we're gonna switch to the other team. But okay, okay. Let me ask you all before we close out here. What do you all do for fun? We talked about a very serious topic here. Obviously, we're talking about one that can affect your quality of life, as well as we are looking to save lives by informing people about this. What do you all do for fun and in your daily lives? And Ms. Amos, I know that you've retired to Mississippi. What about you? What's your most fun activity that you want to share with us?
Oh, I
And remember,
travel
it's an
whenever I
adult
can.
show. Okay,
I
okay.
travel. I love to shop. Okay.
So you're
So
walking as you're doing
I'm
that.
walking, right? I'm walking. And just, anything that's enjoyable to you. Well, fortunately, there's water around me. So sometimes I drive to the water and just,
Sit down,
relax my
right?
mind.
Yeah,
Yeah.
yeah,
So,
that's great. Those are three great
mm,
activities. I really love the shopping and the travel part, and water does soothe my spirit
Yeah,
as well.
right,
Dr.
right.
Kirksey, what
yeah.
do you do for fun? Doctor, how do you doctor yourself?
Oh yeah, no, you got to take care of ourselves because we're patients as well, physicians and caregivers. And so I stay active. I play basketball. I play tennis. I cycle. Anything that keeps me outside with my family, because that's another part, right?
Right.
Sleep and
Yeah.
spirituality. That's
Yeah.
equally important, right? That
Yes.
gives us some foundation and some grounding to
Right.
do these things. So I just try to stay physically active and stay out of my doctor's office.
Right.
and,
Yeah,
and
right,
and
right,
doctor
right,
does not
right.
try to heal himself. Is that
That's right.
right?
Yeah,
That's right.
Okay.
no,
And
yeah.
J. Anthony Brown, what about you for fun that you can
I
share
think
with
for
us?
me, Sybil, is it's going to the movies. I know you're not going now
Well, I'm
because
I'm in
of
solidarity with the SAG
Uh,
people. Yeah, right.
oh, I'm
right
with you, Jay. I'm
and
a movie
everything. But I
goer
love
too.
going to the movies. Yes, yes, yes. But drawing, and it's so weird that I draw so much, and I'm just so afraid to show it to anybody. I probably have maybe 4 to 5 thousand pieces of art that I've drawn, and
Well, let's
it's really
see.
soothing for me. Is there
Let's
one
see.
back there? Yeah, that's my
There's one
art.
right back
Yeah, look
there.
at
Oh,
It's
that's
it's
nice.
it's
Oh, that's
Anthony Brown
beautiful.
work of art. Yeah, yeah. And I'm not paid for that. I just want you to
You're good.
know. um, I do stretching every day, and I try to walk early because in Texas it gets hot.
It's so hot, right?
And now
Yeah.
we received a little bit of relief. So if I'm up early enough, I will, try to walk. And I don't have a pet yet, but getting out and with my guide dog, sometimes that is a way to do it as well. So for people, if we were not able to answer your questions, as Dr. Kirksey said, please go to heart.org/PAD for peripheral artery disease. That's heart.org PAD. Doctor, is there anything that we missed that you want that we cannot close without stressing today?
No, I think it's so wonderful that you have a program that has this reach that's able to get this information out. And I just encourage people to invest in their personal health, just
Mhm.
like they invest in their retirement account or anything
Yeah.
else. I mean, this is the most important asset that we have is our personal health. And if we can
Right,
avoid these chronic conditions, our life is going to be better. We're going to live a longer life, a better quality of life, and see our kids and our grandkids grow old. That's what we want for our Black community.
right.
Amen. Amen. Ms. Amos, is there anything that you that you did not think you got
Well,
across?
yeah, Dr. Kirksey probably should say this, but I'm going to say it anyway. If you are a physician and you do wellness checks or whatever, and the PAD is not part of that, please make it part of that.
Mm, absolutely. And as a caregiver, as one who is going through this, such as you and Jay, and if you have caregivers or people who
Hmm.
go along with you, just as we had one of our people talk about her mother, go in with your loved one as you're taking that loved one
Yeah,
to the doctor and check in and check up on their health and make sure that those things are looked at by their doctor, right?
absolutely.
Absolutely. I'd like to close with our daily inspiration, Yogi's Jewel. Make peace with others who have caused you pain, disappointment, or even trauma. You will be better for it.
Not
Uh,
doing it. Not doing it, Sybil. Not
I
doing
know,
it.
I know. But you will be better for it. I promise
I'll be
you.
back.
Thank
Uh,
you, Yogi. That's a good one.
That
it
is.
is
Yeah.
a good.
Amen.
And a big thanks to the wonderful folks at the American Heart Association, Heather Simpson, Catherine Coffer, Jalen Sandifer, Milena Heydrich, and the ever wonderful Arika Kaysen. I'd like to thank our staff as well. That is Cherie White, Chica Chickadilly, as Diana Chica, she prefers, and also to Yolanda Starks White. And to you all, thank you so much for joining us
Thank
today.
you,
Uh,
Sybil. Thank you for
it's
having us.
Thank
This
you,
is really
Sybil, for
great.
Thank
the,
Yeah.
the
no, thank
show.
thank
you.
you.
Right.
I think
Thanks,
you have
man.
all done your good deeds for the day and you've saved some lives. And that's a really good way to end this show. Thank you for all that you all do. Appreciate it. We'll see you all again soon. Please be well and take care. Aloha.
Aloha. Yeah.
Bye bye.